Patients ask, what should my expectations be for healing and recovery after breast augmentation with an implant? I'd like to tell patients that there is a quick recovery process, meaning going right back to work, downtime, as opposed to a healing process, which means the implants are perfectly settled, they look ideal, and the breast shape has changed to become much more of a natural shape. So what should that process look like? Well, immediately after surgery, I'll come out to the recovery area, show you some photos on table of what to expect in terms of your results. And even the on-table results will look good, but then the implants will change and will feel high and tight to you. Post-op day 1, you're going to feel like your implants are super high, like you could almost rest your chin on them, and that's normal because the implants are in a high position and there's a lot of swelling going on. At around 3 to 5 days, you're finishing up all the medications, you're back at work, doing most of the things that you did before. 7 days, you come back for your 1-week check-in. This is important because you're feeling kind of low emotionally. You're feeling that way because you're withdrawing from narcotic, anesthesia, and adrenaline and cortisol that your body formed during surgery. And that's when we look at you and say, you're doing great, hang in there. The implants are still high and tight, but you're moving in the right direction. At around 2 weeks, you start to feel much more normal. Your swelling has gone down, the skin is softer, but the implants are still high. At 3 weeks, they start to feel like a part of your body and not like a foreign body inside of you anymore. Sensations coming back, the breasts are looking softer and are starting to feel more like your breasts. At around 4 to 6 weeks, the implants start to drop such that the implant goes from looking something like this to something like this. It's a process that takes time as the skin expands between the nipple and the chest wall, and that allows for a change in the total shape of the breast to give you a more natural looking breast. At around 3 months, that's when patients are ready for high definition photography or for a wedding. That's when they come in and say, I really like the quality of the result. And I'll tell you at that time point, you're 100% healed on the outside, but you're only maybe 50% healed on the inside. And the breasts are going to continue to heal over time. See you back at 6 months, 60%, 1 year, 90 to 95% healed on the inside. Most patients are back to working out around 4 to 6 weeks, but they're not doing bench press or using their chest muscles till around 8 weeks. So that gives you kind of an overview of what to expect with regards to breast augmentation. It's not simply surgery and see you later. There's a lot of follow-up that's required. Patients come back at many different time points to make sure that we can further improve the quality of the small scar that's underneath the breast, modulate that with a laser, with injectables, and to make sure that the implants are moving in the right direction and that we intervene early to make sure that you get the best possible result.